Hi again. This is Dr. Russell Radican. I'm the clinical director at Wellness One Memphis, and I'd like to welcome you to part three of a three-part series on the healing power of regenerative medicine. Uh, we're very excited again to be able to bring this type of care and treatment to the Mid-South. I truly believe that stem cell therapy, regenerative medicine, is the future of medicine. And a little background again about Wellness One Memphis. We provide regenerative medicine treatment. We utilize today's most advanced evidence-based protocols and therapies. We're an integrated functional medicine clinic, and we're dedicated to treating acute and chronic pain without surgery. This conditions we treat are osteoarthritis of the back, the knee, the neck, shoulder, elbow, wrist, peripheral neuropathy, ALS, COPD, autoimmune disorders such as RA, lupus, diabetes, and MS, Lyme disease, fibromyalgia, Parkinson's, Alzheimer's, and spinal cord injuries, traumatic brain injuries, and stroke-related disorders all show tremendous benefit and improvement with regenerative medicine. So there's a lot of promise in a lot of these conditions, and we're excited to be able to bring this to the Mid-South. So we're going to talk about stem cell therapy today, and exactly what is stem cell therapy and what's all the buzz about. So first of all, exactly what are stem cells? These cells are unspecialized or undifferentiated. So basically what this means is they have the ability to divide and become anything. Whatever the body tells it to do or tells it to become, that's what they do. And they function to repair and restore damaged tissues. And these cells actually have two types of characteristics. One is self-renewal, and what that means is the ability to reproduce itself indefinitely, over and over. And while doing this, they still maintain an undifferentiated state. Very important. The second is the potency, and that is the ability to differentiate into a specialized cell, distinctly different types of cells as well. So one area can become, say, a chondrocyte, which will help grow new cartilage. Another type might become a muscle, or another might help stimulate bone growth. So that's the beauty of stem cells. They can become whatever the body tells them to do. So a stem cell is a single cell that can replicate itself or differentiate into different types of cells. So it can become the same cell over and over and over, or it becomes different types of cells, whether it be skin, blood, nerve tissue. It's very fascinating the way this can happen. Where can these stem cells be found? The adult stem cells can be found in two places. First is in the bone marrow, and oftentimes that is removed or aspirated from the iliac crest. And the second is from fat tissue, commonly taken from the abdominal region. So adult stem cells are from you. They come from your own person. So that's important to differentiate adult stem cells. So the adult stem cell potency can become skeletal muscle, it can become bone, it can become cardiac muscle, it can become nerve tissue, blood vessels, liver cells, fat cells. Again, anything that the body tells it to become, it has the potential and the ability to do that. So when getting stem cells from the bone marrow is very much a rich source of stem cells, adult stem cells. The bone marrow is acquired usually from the iliac crest, which is the top of the pelvis, and it utilizes a very special collecting system. And when they extract the bone marrow, uh, they put it into a very high speed centrifuge, and it's spun at a very high rate, and this will actually isolate the stem cells from the sample. This is a very relatively quick and simple outpatient procedure performed by a qualified physician in a very safe environment. That is one method of getting adult stem. The next is derived from adipose tissue or fat, basically. We get we have stem cells in our fat tissue. Um, Fat tissue is a very, very rich source of adult stem cells. And it's done, again, with a very special collecting system. And a small incision is made in the abdomen, and a very special type of cannula or a long hollow tube is put in, and you're able to collect the fat in this way. And again, we take this fat and we put it into a very high speed centrifuge to isolate the stem cells. And again, this procedure is performed by a trained physician and takes only a couple hours to perform, so it doesn't take that long. There are actually three types of stem cell therapy. The first type, bone marrow derived stem cells, really started seeing an uptake or a rise in it, if you would, in like early 1980, somewhere in that area. And then here come adult derived stem cells, or I'm sorry, adipose derived stem cells from the fat. And you started seeing an increase in that around 1990. So about 10 years later, they started getting stem cells from fat. But now, if you go the next trend all the way up to 2010, a lot of stem cell therapy is coming from amniotic stem cells. And we'll talk more about that in just a moment. But bone marrow derived stem cells, adipose derived stem cells are an invasive procedure. It is something to understand that you have to go into your body and to extract that. So it is an invasive procedure. So the human mesenchymal stem cells in bone marrow, or just in other words, the concentration of of stem cells in bone marrow, when you're a newborn, it's 1 in 10,000. It's very, very high. It's a very high number. But by the time you become a teenager, that number dwindles down drastically to about 1 in 100,000. Now, as we age, you'll see that the numbers are going up. What that basically means is the amount of active stem cells as we age are very, very low coming from your own bone marrow tissue. So, although it is a very good source of stem cells, it is not as a potent source for stem cells as we age. Basically, as we age, the stem cell activity becomes less and less through time. Now, allograft tissue, these are purified amniotic tissues, and this is an alternative method of obtaining stem cells using allograft tissue. And again, this is from a purified amniotic source, and it's derived from the placenta of a pre-screened healthy donor after a full-term pregnancy and a scheduled cesarean. So basically, mom and baby are doing fine, they're very healthy, and everything's fine. These tissues are what's known as immune privileged. And what this basically means is that you, me, or nobody, our bodies can't or will not reject this tissue. That's what that means. It's very, very important because if your body were to reject it, it wouldn't do you any good. You wouldn't get any benefit out of it. So that's very important. These tissues also include a number of structural proteins and growth factors, which also promote cellular proliferation and new collagen formation, and also reduce inflammation. So there are a lot of benefits on utilizing allograft donor tissue. So some of the advantages of allograft tissue, once again, it's a matrix of healing properties that include growth factors, cytokines, cells, electrolytes, enzymes, and also has an antimicrobial effect. So there are a lot of benefits of using allograft tissues. So, what actually is involved in using allograft? So, what is the procedure involved? So, the procedures promote healing and regeneration within damaged tissue and joints and can be used in conjunction with surgery or without surgery to reduce inflammation and speed up the healing process. These procedures also can prevent patients from needing joint replacements or major surgery and keep conditions from becoming worse over time. So they're very, very effective on slowing down destructive processes and can prevent a lot of surgical cases. So it's a very interesting treatment method. So the amniotic tissue and the amniotic membrane and amniotic fluid provide biological and physiological properties that actually will act as a physio barrier and cover and protect the fetus during pregnancy. So it's very important to understand what this is. This has nothing to do with the baby itself. It's the membrane and the membrane surrounding the fetus and the fluid that circulates within. These fluids are obtained from a purified source that provides the healing matrix of growth factors and proteins that actually help the human body to heal naturally. And these amniotic tissues have proven to be effective in treating a tremendous number of painful conditions and many other illnesses of the body, as we previously discussed. See, the allograft tissue also has cord blood tissue, and much like amniotic tissue, they have several regenerative properties that have proven to be a very effective treatment in so many different conditions. And we actually utilize this in a flowable injection that can be obtained again from the cord blood tissue, and also this is injected into the damaged area of the body. This biological matrix contains a tremendous amount of growth factors, cytokines, hyaluronic acid, extracellular matrix, and tremendous other types of cellular materials, mesenchymal stromal cells. And again, these are important things from a clinical standpoint, but from a patient standpoint, basically what this means is that this injection can help heal and repair a lot of joint muscular injuries. It can help heal and repair a lot of disease processes, because that is what that's what these substances do. So the clinical applications of allograft tissue, oftentimes for soft tissue defects and trauma or injuries such as tendinitis, tendinosis, chronic wounds. Actually, it's very interesting how this can be utilized for unhealed wounds. This can help these wounds close up, heal, and repair very fast. It's very, very fascinating. It will localize the inflammation, and it's good for chronic and acute pain, osteoarthritis, tendon, ligament repair, and of course, joint pain. So, one of the things that I mentioned before in a previous slide was we actually combine our PRP with our allograft tissue or our stem cells. We don't just inject the stem cell or allograft tissue by itself, because we found that utilizing PRP to act as a buffer or a matrix to mix our product with speeds up the healing, repair, and inflammation, and speeds up the recovery so much faster than doing the stem cell alone. So we're very happy and excited about utilizing this treatment method. And that's kind of one of the reasons why our process tends to have very, very good outcomes. Stem cell therapy has been extremely effective in wound care, as we previously talked. It's also very good in aesthetics, believe it or not, for facial and hair growth. We talked about that earlier. We're very excited about being able to bring a certain treatment method to help stimulate your hair growth. So please stay tuned for that. We're very excited about that. Now, obviously, it's very good for pain treatment and different types of things as well. Traditionally, stem cells have been used to stimulate the healing of tendons, ligaments, and bursa and joint issues, but we use it for a variety of things. Basically, if it's a joint, we can utilize stem cell, and that includes everything from the spine to the fingers and the toes and the ankles and everything in between. But we also utilize stem cell therapy for disease processes such as COPD, peripheral neuropathy, lupus, RA, Lyme disease. So there's so many different conditions out there that respond very favorably and very positive with stem cell therapy. This is a patient who had adult stem cell therapy, and I'm going to let you watch this video at your leisure, and when you complete the video, just go to the next slide. What exactly is the procedure? What does it entail for stem cell therapy? Well, first of all, it's a very simple and safe outpatient procedure. It's performed in our office by a qualified doctor. And depending upon the methods you choose, it's relatively straightforward. First step, if we decide that you are going to utilize your bone marrow or fat tissue, we'll actually isolate and remove that. Now, again, this is an invasive procedure, and it's something that requires a little more time, and that is step one. Now, if you choose to do the amniotic stem cells, half the battle's already over because we don't have to remove the bone marrow or the fat tissue. Step two would be if we do remove the bone marrow or fat tissue, then what we do is actually utilizing the centrifuge and isolate the stem cell from the bone marrow or fat tissue. And again, if you decide to utilize the amniotic stem cells, we skip this step too because we don't have to go through this process. And the amniotic tissue is delivered directly to the doctor's office, and it's ready for injection pretty much immediately. Now, although this doesn't say this here, but we actually will take, in most cases, we will take a sample of your blood because we utilize PRP to move into step three. We'll actually mix the PRP with either the stem cells or from the amniotic stem cells, and then we'll inject that into the damaged site or injured region, or in some cases intravenous. And that is a process that helps heal. So the procedure itself is relatively straightforward. This next video is actually a procedure of the stem cell, so it's pretty straightforward. So again, just go ahead and watch it at your leisure and then move to the next. At this point, you have a lot of questions. Hopefully you have completed both both presentation 1, presentation 2, and now we're finishing presentation 3 on regenerative medicine. So you have a lot of questions, and we hope to be able to provide you with those answers because we know that living with acute or chronic pain is in fact a daily struggle, and it's hard sometimes. It's very difficult, and you may feel like there's no hope for you, and you just have to suffer with pain. Well, we want to let you know that we're here to help you. We can actually diagnose what's going on and evaluate whether or not stem cell therapy is the best treatment option for you. So you have to decide if you're going to stop letting pain run your life and call our office, because you have to decide what you want to do. What we'd like to do is move into the next step because we've made it very easy for you. All you have to do is click on this page and it'll direct you to our landing page where you can actually fill in your information, your name, your phone number, the best time to contact you, and indicate that you're interested in stem cell regenerative medicine. And someone from our office will contact you as soon as possible to discuss the appointment times available and have you come in. Now, it's a complete, thorough evaluation, examination, and the normal fee for that is $475, and we're giving that to you as a gift to find out, to remove any obstacle or barrier that may be preventing you to find out if regenerative medicine is for you. So once again, all you have to do is click on this landing page and it will direct you to our website. You need to take the first step. This is the very first step. You've watched these seminars. Now what you need to do is go ahead and schedule a consultation, and we'll go from there. And once again, I would appreciate if there's anyone that you know, a family member, go ahead and forward this information, whether it be presentation 1, 2, or 3, or all of them. It doesn't really matter. We really appreciate that. Remember, a candle loses nothing by lighting another candle. Once again, I thank you, and I look forward to meeting you and helping you regain your health and well-being.